Welcome to the RRK podcast. In this episode, we'll be discussing reptile obesity with specialist exotic vet Tariq Abou-Zahr. So Tariq, the first thing we ought to discuss is how you got here. You're one of the few specialist exotic vets that I know, which puts you in a different place to most vets, I understand. Tell us how you got here, how you first started training and how you became a specialist in that sector.
Well, I'm unusual in some ways because I was a keeper before I was a vet.
That is unusual.
Usually it doesn't happen that way around.
It doesn't.
So I've been keeping exotic animals since I was 7 years old. I started with birds. Actually a pair of budgies that I got for Christmas. And I kept various birds. And then when I was 11, I got a corn snake. And I haven't been without a reptile since.
Cool.
And throughout school, I really enjoyed biology, and I enjoy communicating with people. I like animals, I like science, I like people. So I went to vet school knowing that I probably wanted to follow this line of inquiry, as in exotics.
Yeah.
And the rest is history. So I did 5 years at the University of Bristol doing my vet degree.
Yeah.
So that's kind of where most vets stop then, and they go into practice and they're sort of GP vets.
Yeah.
But then I've done some training post-graduation. So I did an internship and then a residency in exotic animal medicine. And I had to publish a lot of papers and present at lots of conferences, including international conferences, and do some research. And then I sat some very hard exams. And I've got my certificate, which is kind of the middle tier qualification.
Yeah.
And then I have a diploma as well, which is pretty much the highest qualification that you can get.
Okay.
My subspecialty actually is in avian medicine. So I do a lot with parrots, and birds of prey and pigeons and various other things. But I see a huge number of reptiles as part of my caseload. I don't do any dogs and cats.
So how many vets of your qualification level are there, do you think, in the UK, let's say?
I think in the UK there are 30-something exotic animal specialists.
Goodness. And how many generic vets?
Oh, that's a good question. Thousands.
Thousands, yeah. So you're a rare delight.
There's not many of us. I mean, there are more vets that have an interest, a special interest in exotics.
But in terms of training and...
Exactly. There's not so many.
I've got you. So just as a slight aside, what reptiles do you keep nowadays?
I've kept all sorts over the year, pretty much kept everything you can keep. But I really like Indo-Australian pythons. Okay. I really like carpet pythons and Antaresia, like the dwarf pythons. And Aspidites, like blackheads and Woma pythons. So I've got, Breddles pythons, jungle carpet pythons, inland carpet pythons, Darwin carpet pythons.
That's quite a collection.
Yeah, spotted pythons, Stimpson's pythons, and Woma pythons.
Lizards?
I don't keep any lizards.
Have you ever?
Yes.
Why don't you keep lizards?
Time.
Good point, well made.
Snakes are much easier to manage, aren't they?
Yeah.
I mean, snakes need to be checked, and they need regular care, but they're not quite so labour intensive.
Good call. Good call. Okay, quick question then. An amusing question, I would assume. How many of your reptiles are overweight and obese?
I would hope none of them.
I would hope none of them.
I don't think any of them are. Okay. I don't think so.
Okay, as a vet though, how much obesity do you see?
I guess I see two different types of consultations as a vet. So I see the sort of routine checkups and health checks where the owner doesn't necessarily have a concern, as in their animal is doing well, but they want it checked over. And I reckon a reasonable percentage of those...
Do you want to have a stab at what percentage it would be?
I think it's probably, to pull a figure out of the air, I think it's probably 15-20%.
Okay. I mean, we won't hold you to that, but, you're a pretty good litmus of it.
But then I also see reptiles that are sick, and I see more reptiles that are sick than I do reptiles that are healthy. And I think of the reptiles that are sick, it's much less of a proportion,
Yes.
because they tend to present the other end of the spectrum, as in underweight, thin, sadly sometimes emaciated, when it's been going on a long time.
So what I think you're saying is that the well-kept reptiles are sometimes slightly too well-kept.
I think that's fair to say.
I think that's where we've kind of looked at obesity in most taxa, is that it's a terrible phrase to use, but killing them with kindness is the phrase that's often used.
It's the same with people, isn't it?
Absolutely, yeah. Tell me. So is there any data that you know of that's available to tell us accurately how many reptiles are obese? I mean, we're trying to find out, is there an obesity problem?
Yeah.
Would you say that there's an obesity problem? And if so, how do you know?
Well, I think obesity is suboptimal for health.
True.
Therefore, if there is any obesity, there is a problem.
Good point.
So I think you could say there's an obesity problem. I think there are lots of other problems that probably are more of a problem, but I do think it's a problem.
Okay.
And there were many parts to that question. What was the first part?
Is there a problem? And when I say is there a problem, I suppose I should qualify that a little bit. So we know that kept animals of all taxa have a propensity to be obese, whether it be cats, dogs, rabbits.
It was about data, wasn't it?
Yeah, so in comparison with other animals, do you think reptile obesity is a problem that we need to start focusing on? And if so, is there any data to qualify that?
As far as I know, there's no big study that looks at the prevalence of obesity, i.e. there's no one that's gone and looked at 1,000 random pet reptiles, knocked on people's doors and said, can I body condition score your reptile? So in terms of really giving you an accurate figure, I think it's difficult. I think if you look at lots of textbooks and you read scientific papers, you'll see lots of people are saying obesity is common in reptiles.
Yeah.
And that fits with my own experience as well.
And how about social media? I mean, we look at reptiles on social media and we're all familiar with the big fat cheeky bearded dragon or the plump corn snake.
Yeah.
Do you think that's a decent measure? I mean, I know it's only anecdotal and I know it's not a proper study.
Yeah.
But just by putting a wet finger in the air, I and many others, and I would assume you as well, are starting to have a twitchy eyebrow about the number of obese reptiles that we're seeing.
It's definitely a problem.
Same as all taxa.
Yeah, same as everything. And it's a difficult one because often you're talking to an owner about their overweight animal when they themselves are overweight. And it can be a difficult issue to express in a positive way that's not going to get you into trouble. It's very difficult to give people advice sometimes.
It is, and I have this conversation with my wife and our very slightly fat dog as the topic of conversation. And the difference is that I am psychologically weak, and when I see chocolate and cake, I feel compelled to eat it.
Yeah.
But my dog only gets to eat what we give him, largely. So that's a more manageable situation than having to deal with our own compulsions and habits and weaknesses.
Yeah.
So I would hope that animal keepers and reptile keepers specifically would be in a better position to manage their reptiles' obesity. But we'll come on to that, what we can do about it at a later date. Our good friend Chris Newman at National Centre for Reptile Welfare reckons that obesity today is a far more common problem he experiences than MBD, metabolic bone disease disorder. You
could say either. Disease usually.
Yes, I would. He sees more obesity than MBD, which is calcium phosphorus deficiency.
Yeah, metabolic bone disease is where the animal doesn't have enough calcium or vitamin D3, which can be caused by diet, or it can be caused by UV
lack of
UV or inappropriate UV.
And that used to be a big problem with reptiles, didn't it?
I think it still is a problem.
Okay.
So I still see MBD.
Okay.
And that's that's a whole other discussion.
Oh, it is,
but I definitely think things have come a long way, and we clearly see a lot less MBD nowadays than probably my colleagues would have seen 10 or 15 or 20 years ago.
Yeah.
But MBD is still a problem, and we do still see it. In terms of comparing the two, I think obesity is more common than MBD these days.
it's a bad problem to have, obviously, obesity.
Yeah.
But, you know, I remember when MBD was a big problem, that was because we didn't know enough. That was because we didn't have the knowledge to keep the animals well.
Yeah.
Now that we do have better knowledge and we are able to keep our animals better, the problem has slung itself to the other end of the spectrum, and they're being kept too well.
Yeah.
Which probably isn't the right terminology, but you get my drift.
I think what you're saying is that people have good intentions.
Yes.
And they want their animal to be well fed and well nourished, but sometimes maybe they take it a bit too far unintentionally.
One of the questions I wanted to ask you was, which species do you see affected most by obesity? Shall I guess?
Go on then.
Beardies.
Keep going.
Leopard geckos.
Yeah.
Corns.
Yes.
Boids.
Yeah.
Boids, boas. Yeah.
So I think it's... What do I think? Corn snakes... I see a lot of obesity.
Is that right? I thought beardies would be top of the list.
Beardies and corn snakes and leopard geckos. I pretty much agree with all of the ones you've just mentioned.
Yeah.
I think corn snakes, as far as snakes go, in terms of the snakes I see, because dealing with the pet-owning public, the majority of snakes that I see are corn snakes and royal pythons.
Yeah.
But not exclusively, but that's a huge proportion of my caseload.
Those are the two biggest, most popularly kept, aren't they?
I do see obese royal pythons.
Okay.
But it's fairly rare, I would say. I think royal pythons are quite good at regulating their own body weight. You know, they'll just go for a fast.
Yes, good
when
point,
they've decided that maybe they've had a bit too much.
For our American viewers, of course, the royal python is also called the ball python.
Ball python. But corn snakes don't do that. They don't fast.
Just keep on eating.
They just keep going.
Yeah.
You feed them and they eat.
Yeah.
And yeah, so corn snakes are the most common snake I see. But large constrictors.
Yeah, why?
I think it's because some people want
to see a
they want to grow them as big as they can.
Yes.
I mean, you've only got to, I'm not going to name any names, but you've only got to look on YouTube and you'll see lots of very big reticulated pythons in particular. It's more of a thing in retics than it is in berms.
Is that right?
I think. Well, in my experience, yeah. But I think that's because retics
have the potential to grow.
Exactly.
Yeah.
Lizard-wise, yeah, beardies most commonly, leopard geckos very common, and then it's your things like tegus,
bosks,
and bosks. Bosks.
Have you ever seen a thin one? Have you ever seen one that was the right weight?
They're often okay when they're young.
Yeah.
But I don't know if I've ever seen a 4 or 5 or 6-year-old bosk
that weren't obese.
That wasn't obese.
And they're not just a bit fat, are they?
No. So that species in particular is a challenge.
Tell me why.
I think bosk monitors, from what I understand, and we're all learning, but if you look at some of the research that's been done about their natural biology, there seems to be this school of thought that in the wild they undergo what's called a diapause, which is basically where they come from in Africa, they have a dry season and a wet season, and in the dry season they basically just stop eating, or food diminishes substantially.
Yeah.
So for like a significant portion of the year, they're barely eating anything.
Yeah.
And you see pictures of wild bosk monitors, and they are skin and bones. And I was watching, there's another reptile YouTube channel where they go to the habitats of common pet reptiles and they have a look. And I was watching one recently on bosks, and they found a bosk in a burrow that was a skeleton. You know, it looked like it was dying.
Yeah.
And we don't know what was wrong with it. And maybe it did have kidney disease or cancer, or who knows. But a lot of the comments were saying, well, actually, that's just a bosk that's going through diapause, and it's a natural process. See,
that's my understanding from conversations I've had with people who've looked at the research about bosk monitors. And I think there was a guy called Daniel Bennett. Daniel Bennett?
That rings a bell.
Yeah. He did some research into bosks, wrote a few books, and then came back a few years later and says, actually, everything that we thought about bos was wrong, and actually the diet and the fasting that they do and the way they look when they're fasting isn't something that you could countenance in captivity.
No. But as responsible reptile keepers, we have to have a think about what species we're recommending people keep.
Yeah.
I'm not in favour of banning bosk monitors by any stretch, but bosk monitors are a very advanced species.
I think so.
And I don't think we fully understand exactly what we need to do to keep them properly.
Yeah.
There might be a very small number of keepers, and there are only 1 or 2 or 3 people breeding them consistently.
Yeah.
So I think we as reptile keepers need to police ourselves, and they are not a species that we should be seeing widespread in reptile shops for £50 or £70 for sale to the general public.
I think this is something that the reptile trade has done quite well over the years and is still gradually doing.
I think with bosk monitors it has
slowly moved in that direction.
When I was a teenager, you'd go into any reptile shop and you'd see, hatchling bosk monitors there.
Yeah.
But I think it needs to go a similar way to the way green iguanas have gone. Yeah. I actually think bosk monitors, personally, and this might be controversial, I think bosk monitors are actually harder to keep than green iguanas.
There's a good chance that could be true because of their environmental conditioning.
I've got lots of not lots, but I have green iguanas on my books that are in their teens.
Yeah.
I haven't got any bosks.
Yeah, they go downhill quick when they're wrong, don't they?
But there are lots of other monitors that make great pets.
Yes.
Ackies. Fantastic.
Yeah. Absolutely, good point. And this, I think, is the key. Why would you choose a green iguana when a bearded dragon is probably more suitable? Why would you choose a bosk monitor when a ridge-tailed Ackie is more suitable?
Yeah.
It's a very good point.
Some species are better suited to captivity and easier to manage.
And this is something that the trade looked at years ago when it was decided that perhaps we don't sell as many iguanas and perhaps people don't have a bad experience as their first initiation into reptile keeping. Perhaps they have a better species and have a better time with their first experience, and perhaps they become enthusiasts. Perhaps they become lifelong customers. So maybe it's the same transition to be thought of when we're talking about bosks as opposed to Ackies or other lizards. Here's a good one for you. As a vet, how do you know if your animal is obese?
It's more to do with the body condition than it is to do with the weight. People always come and see me and they say, well, what weight should he be? But actually, just like with people, reptiles can vary in size. You get some very big individuals and some very small individuals. So it depends on the muscle and fat cover over the body.
Yeah.
There are, for some species, official condition scoring systems.
Oh, I'd like to know which species.
Some random ones, actually. Things like side-neck turtles.
Of course.
White tree frogs.
Yeah, I saw the whites one, yeah.
Yeah, I mean, to put it very simplistically, so for snakes, you kind of want the back to look like this.
Yeah.
And if it looks like that, it's too thin.
Yeah.
And if it's bulging to the point where there's a crater in the middle, it's too fat.
Good point. Yeah.
But I think what would be ideal for a pet reptile owner is to go and see an exotic vet once a year or twice a year.
This is a topic that I'm going to come onto. You'll like this.
And then what I think then is, if your animal is an ideal weight and it's fully grown, weigh it regularly and keep an eye on the weight. And if it's going up and up and up and up, you know you're doing something wrong.
Yeah.
And if it's going down and down and down and down,
which is true of adults, of course.
Yeah.
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 I mean, what we're talking about really is based on our own experience and our own judgment to some degree. But most people who've worked with reptiles for long enough would be able to look at an animal and say, hey, he's getting a bit chubby, or she's getting a bit chubby.
Yeah.
We could do that, but I think the average new keeper wouldn't have that ability, which is why they need to get some advice from people who know what to look for. would we look? How would we assess an animal? We know we don't have any baselines. We don't have any data to work with. A 3-foot lizard should be this amount of kilograms. There's not even that basic data to be had. So I think that's a trip hazard. That's a problem that we should ideally be able to deal with and have more data to work with.
We need more science, and I would implore any institutions, any students, places like the National Centre for Reptile Welfare to do some studies and put some figures out there. Get these animals assessed and band them into healthy, optimal specimens and work out an average weight range. But it's the condition score, as I keep saying, that's so important, and we shouldn't get too hung up on the numbers.
I think it's very much like body mass index in humans. In that, as a weight trainer, a bodybuilder can be 14 stone and in really good shape, whereas somebody who dines at McDonald's most days and is 14 stone probably isn't, and they weigh the same, and their body mass index would be the same. But it's not an ideal. It's not a perfect score.
No.
But it gives us a good idea for the average specimens.
Yeah, and for tortoises. And
tortoises that you can't look at most of their body.
No, there is. Have you heard of something called the Jackson's ratio, which looks at the length of the tortoise relative to body weight, and it's a bit controversial. I think tortoises are some of the hardest animals to condition score, obviously because of their shell. But if you come to someone who looks at a lot of tortoises, say an exotic vet, and most exotic vets will see lots of tortoises. I see them every day. You get a feel for the musculature of the legs. The thin ones, you can still see there's a depression in the leg.
Right.
They have a lot of subcutaneous fat around the head and the neck.
Okay.
So
you can still visually
you can
assess.
still visually, but you need a bit of experience.
Yes, absolutely. As far as I'm aware, the National Centre for Reptile Welfare is collecting data on the main species, and obviously they'll have to collect that data for a while for it to be good. But then the other thing that we have for bearded dragons specifically, Beardy Vet?
Yes.
So he's been collecting weights for wild specimens for a long time, but that opens up a whole other conversation about how useful that data about wild specimens
that's tricky. That's tricky because a lot of our captive specimens, there are certain lines that have been selectively bred to be big. Like German giants. Have you heard of those? And that blood has been mixed into the mainstream. And also, there has been some hybridization between inland bearded dragons and Rankin's dragons. So, does the wild-type bearded dragon average necessarily correlate with our domestic bearded dragons? I don't know. Because I think bearded dragons are well on their way to being domestic. Yeah.
But the other point to consider is that most wild bearded dragons, wild animals in general, have environmental stresses and conditions that we simply wouldn't want to replicate in captivity.
A lot of wild reptiles are not an ideal weight.
They're on the brink of existence in many cases.
Often, I've seen plenty of reptiles in the wild, and a lot of them, if that came into my consulting room, you'd be having words with the owner. You'd be saying there's a welfare issue here. The wild is great, and I love the wild.
But it's a terrible place to live.
Can be a terrible place to live.
But I think those wild weights can give us an indication, and perhaps when we've got enough data and enough animals along that scoring spectrum, we'll be able to say, okay, wild dragons are approximately this, and is it 5%, is it 10% or 20% that becomes optimum? Who knows? It may give us an indicator, but I don't think it should be the benchmark.
But it's certainly not going to do any harm to
have that knowledge.
Exactly.
Yeah, for sure. Tell me about the medical issues that are caused by obesity, because obesity is not benign. It's not just an aesthetic thing. Yeah. There are medical issues.
Yeah. So what tends to happen is the body stores fat, and it stores it as like fatty lumps in the abdomen.
Yeah.
And it stores it in the tissues of organs. And it can also store it under the skin. And there are loads of health problems. It reduces lifespan. it means the heart has to pump blood harder to get around everywhere, sometimes because there's pressure from fat on blood vessels. It's got to supply the fat with blood. And also, there have been cases in reptiles where you've got atherosclerosis. Have you heard of that? That's like a build-up of cholesterol in the blood vessel walls.
Okay.
So which narrows the blood vessels.
Is that where heart attacks come from?
Yeah. So that kind of condition has been documented in reptiles. Interestingly, it happens less in reptiles than it does in birds.
Oh, why is that?
Who knows?
Okay.
Ask God. I don't know. It's one of those things. But heart disease, liver disease, kidney disease, reduced lifespan, all sorts of things. It can put pressure on the feet. So you get like pododermatitis.
I did not know that.
Yeah, and arthritis, because it puts pressure on the joints.
Goodness.
Loads of stuff. If a female reptile is trying to give birth and there's lots of fat in the tummy in the way, we see more problems with egg binding.
That's when they can't lay eggs.
When they can't lay their eggs.
Yeah.
Or in live bearers, problems with dystocia, which is where, they can't get the babies out. They get stuck in the pelvis or whatever.
Yeah. But it's also an issue for people who want to breed their animal. Surely a fat reptile is suboptimal and therefore likely won't breed. So that's something that potential breeders should be thinking about.
Well, especially male reptiles, they can be very lazy then and not get the job done.
Good point. Yeah, I hear you.
If you love reptiles and care about reptile welfare, why not become a responsible reptile keeping member? For the price of a cup of coffee, you can receive a whole range of membership benefits, such as our free quarterly magazine, responsible reptile keeping mugs, t-shirts and window stickers, as well as discounts from selected reptile retailers. To find out more, head on over to responsiblereptilekeeping.org.
I suppose we ought to look at why obesity occurs, which sounds like a really easy question to answer. But when I started looking at it, there turned out to be layers upon layers of reasons why reptiles become overweight. So let me start by throwing something into the mix about what humans are like. And I think we're feeders. So every time I go around my grandmother's house or around my auntie's house or around my, friend's mum's house, oh, have a biscuit, have a cake, are you staying for dinner? It's almost culturally compulsive for us to feed things.
Yeah, or I've got 5 potatoes left. Can you finish them up for me?
Yes. This is it. And it's good manners to provide food. And so that, I think, is one of the reasons why we find it so good, so pleasurable to feed things.
Yeah.
And we've already used the phrase "killing them with kindness," but I think when we look at it from that perspective, we're trying to do a favor, we're trying to do something nice, and killing them with kindness sounds like a more appropriate phrase. The more I think about it. I was speaking to a store owner. In fact, it was Chaz up at Snakes and Adders in Sheffield. And he says he regularly gets the situation where they've run out of locust and a lizard owner has come in for their food. And they say, hey, well, we're out of locust today. They'll be in tomorrow. And the owner goes into a panic. But, oh, my God, he needs to eat today.
Yeah.
But does he really?
Yeah. Well,
does he really?
No, it's the short answer, isn't it, a lot of the time.
What would happen in the wild if there weren't any locusts on the shelf?
Well, that's the thing. These animals are ultimately, a lot of them, wild animals. Well, they're not wild as in from the wild.
But they behave as such.
But they behave as such. And so we have to think about how they would live and what they would encounter and some of the challenges they would face in the wild. And they wouldn't be fed a box of 20 locusts every day in the wild.
And if they miss a day?
Yeah. Or 2 days.
Exactly.
Or 3 days.
Exactly.
But they shouldn't, if they're not eating for a week or two,
then think about it.
If they're a lizard, you know, bearded dragons, if they don't eat for a week or two, they might start to get liver problems and things. But a day here and there, 2 days, 3 days,
doesn't matter. Not going to be a worry, is it?
Yeah.
So.
And speak to your vet. If it depends on the condition of the animal. If they are a little bit thin, we might want to be feeding them every
More
day
often,
and more. Yeah, exactly. So it depends on the animal.
I mean, as humans, we're kind of conditioned ourselves to eat 3 times a day, but as mammals, we use a lot of our energy, the calories from our meals, to create body heat.
Yeah.
And that's not something reptiles have to do because they get all their body heat from the sun or from your heater.
Yep. So basically, why does obesity happen? Too much food or not enough exercise.
Exercise is something I'd like to speak to you about.
Yeah. So that the exercise is something that all owners can consider. Enclosure sizes. Yeah. That's a controversial issue. But
still
it's
relevant.
Important.
Yeah, still relevant.
You know, keeping animals in enclosures that are too small can lead to obesity.
Yeah, okay. The other reason why I think obesity is more prevalent is because feeding your reptile is one of the most interesting things you can do with it. Whether it's a snake or a lizard, feeding day is one of the most interesting times.
Well,
so
a lot of snakes are sedentary and do hide a lot of the time. And when you see them in action is when you're feeding them.
Yeah.
So I totally get your point. And I think some people want to see that action a bit more frequently than it probably should happen.
Yes. Absolutely.
Yeah.
How about prescribed feeding regimes? Because I remember working in a reptile pet store in the 80s and in the 90s. And if the animal was feeding, that was a good thing. Keep feeding it.
Yeah.
How often do I need to feed my snake? Once a week.
Yeah. I think it's very difficult to answer that question in shorthand. I think I think an average of once a week or once every 2 weeks for most snakes works, but it doesn't have to be bang on.
Yeah.
You can miss a week here and there.
And it depends on the condition of the animal.
And it depends on the condition of the animal, and it depends on the size of the prey item that you're giving, or how many prey items you're giving at once.
Yeah. And where the animal comes from, and how it would experience food in their natural environment.
Yeah.
And whether or not they have, breeding seasons and hibernation seasons. And
whether you're breeding them, because that's a huge energy expense.
Exactly.
Whether you're then brumating them, because that makes a big difference.
There's a lot of things to think about.
Lots of variables. What I would say about corn snakes, and this is just an observation, it seems to be the ones that the owners feed rats. That's just very simple.
And when we say rats, we're talking...
usually it's weaner rats.
Yeah.
Because the corn snake's only so big.
Yeah.
But if you stick to medium or large mice, because they're a fair bit smaller than a chunky old weaner rat, I think it's just too big a prey item.
Yeah.
Too frequently.
And would you say that good advice to someone who presents an obese reptile, would you say that good advice is to feed less often and smaller sizes? Is that generic advice that's universal?
If you prolong the interval too much, the animals are so hungry that they are, I think, to some extent in distress.
Good point.
I've seen snakes that have been starved for weeks and weeks and weeks, often as part of prosecution cases.
Goodness.
And you're opening the viv, and they're just biting the substrate, and they're biting the hide, and they're just so desperate to eat.
So fasting is not an option.
I don't think so. So what my point is, I think you don't want to leave them months without eating to control their weight. You want to stick to a reasonable interval, but feed a smaller item.
So instead of feeding it once a week, you might feed it once every 10 days.
Maybe, or every 2 weeks.
Or every 2 weeks.
Or every 3 weeks.
Dependent on the
animal.
size of the animal. Yeah, good point.
And then the size of the prey item is very important as well.
For sure, for sure. And it's important to stress that we're talking largely about adult snakes here when we're talking about frequency of feeding, because, of course, young animals need to feed more often, obviously appropriate size food, but more often because they're growing.
Growth requires energy and protein.
But when they stop growing, what do they do with those extra calories?
They store it.
Yeah. Yeah. How about the point, and this is an interesting conversation I had with a friend of mine, captive foodstuffs are nutritionally dense, but wild foodstuffs are evolutionarily speaking, usually suboptimal. It's the sick animals, the old animals, the frail animals that get caught by predators. And so we obviously don't want to perpetuate that. You don't want sick, frail, old feeder mice in captivity. So it's not something we can do much with, but it's an interesting observation that all of the big, healthy, well-fed, well-nourished mice, locusts, etc., are a very different foodstuff animal to what they catch in the wild.
Or even the vegetation. I see so many Herman's tortoises that eat bags of floret lettuce.
Yeah.
With your lush kale and your lamb's lettuce and your romaine lettuce. Yeah. But if you go to Mediterranean regions, it's all brown, fibrous,
dried up grasses.
Exactly. So feeding weeds and things is what we recommend, because that's better.
Yeah, absolutely. Let's talk about where keepers can go for help. And I know what your answer is going to be because you're a vet.
Yeah.
Yeah. But let me throw this into the ring. So we've already discussed the fact that there's approximately 30 or so vets of your specialism in the UK. Can we compare the ability of an average generic pet vet to identify and treat obesity with the ability of a typical specialist pet store owner? Because from what I can tell, a pet store owner would likely see more reptiles and more species than the typical generic vet. Would that be true? Difficult question, I realise.
That's a difficult question to answer succinctly. So there's a number of things I would say. The first thing is, any kind of determination about the health of an animal is a vet's job. And, some store owners may be very experienced and very familiar and may even have some idea about what's going on, but any clinical determination should be made by a vet. And
does obesity fall under that?
I don't think it's wrong for store owners to glance over an animal and say, I think that's thin, I think that's fat, maybe cut back on the food a little bit, maybe feed it a bit more.
Yeah. But when it gets to a point where...
When it gets to the point where they're lethargic and they're not themselves, then I think they need to go and see a vet. And store owners vary a lot as well.
Good point.
This is controversial, but maybe.
No, I
don't know.
No, I think you're absolutely right.
There are some very switched on, very scientifically aware, very welfare aware store owners. And
there's the other end of the spectrum as well.
I've sadly seen reptiles in the clinic that have presented to me very thin, where a problem has been going on for a month or two or three, and they've been liaising with the pet shop and they've tried a 100-watt bulb instead of a 40-watt bulb, and
they should have been
here talking to you. They should have had a blood test and an X-ray, and we should have got some treatment started sooner. So I think it's tricky territory. I think reptile shops are an important part of the local community, and they are, for many people, the first port of call.
Yeah.
But I think reptile shops should work closely with vets, and vets should work closely with stores, and it should be a collaborative approach.
For sure. I think I'd stick a flag in the sand, whether I'd be a vet or a store owner or even us at Responsible Reptile Keeping, and say, if at any point you are concerned about the health of your animal, go to see a vet.
Yeah.
But on the other side of the scale, a lot of the pet store owners that I've spent time with would be able to say, hey, this reptile is a bit fat. Maybe you should do X, Y, and Z. And then that might be more accessible for most people, and also a more reliable diagnosis if they don't have a specialist vet to go to.
Absolutely. But they don't have to go and see a specialist vet. They can go and see a vet who is not necessarily a specialist, but who has experience and knowledge with treating reptiles. So if you have a sick pet reptile, don't book it in at where you go on their website and there's no mention of any reptile medicine, because that vet is probably going to look at you and say, well, I've got no idea.
Go and see Tariq.
Come and see me. But even if you don't come and see a specialist, go and see a vet that has an interest. There might only be 30-something specialists, but there are, I think, hundreds of advanced practitioners, which is kind of the middle tier.
Yeah.
So go and see an advanced practitioner in exotics, or even just a GP vet that
can push you in the right direction. Yeah.
That advertises that they have an interest and they have experience with those species.
Why do we think there's not more training about reptiles for general practice vets, given how popular reptiles are today?
It's a difficult one, and it's a complex one. And again, it's not an easy one to answer. The veterinary curriculum is full to the brim.
Yeah.
As in the amount of stuff that we need to learn about anesthetics and antibiotics and surgery and everything else is already, believe it or not, difficult to fit into 5 years.
Yeah.
So it's finding that extra space in the curriculum, and most vets don't actually, the reality is, see that many reptiles, you know.
Do you think there's a chicken and egg situation?
The question is, do we train generic or general practice vets up to be savvy with reptiles,
to a level,
which I think is difficult though, or do we just say go and see someone who has an interest or additional qualifications in exotic animal medicine? And I think the second option there is the way that society is moving.
More achievable.
I mean, we didn't have exotic vets, you know, 15, 20 years ago. We did, but it was even less than we do now. And the veterinary profession is developing, and we are seeing more and more and more exotic animal savvy vets. So I think from an exotic animal welfare point of view and an exotic animal medicine and surgery point of view, we have evolved a lot.
Yeah.
This clinic here, I opened this department 3 years ago or 4 years ago. And before that, it didn't exist.
Yeah.
You know, and as more people with an interest come through, more clinics will open.
Just coming back to the obesity issue again, just trying to come around the side of that. So I think we can agree that vets don't see reptiles so often, and I'll take a guess at why that is. They don't come in for jabs. They don't come in for to have their teeth cleaned.
Or neutering.
They don't come in for neutering.
Yeah.
And generally, they don't come in for routine checkups.
But they should.
But they should. So
some of them do.
I realise, yeah. And that's great. But if coming back to the reptile obesity thing, if we were to have some kind of system where even a general practice vet could say, right, we're going to do annual checkups.
Yeah.
We're going to do fecal sample. We might do bloods. We'll do a visual body scoring for obesity. What else could a vet do as part of an annual checkup?
A nail trim or
a nail trim. Offering those services on an annual basis would bring reptiles into the same kind of welfare, cared for, veterinary scrutiny that dogs and cats enjoy. So you don't do dogs and cats, I assume,
No.
but you know, your colleagues will see a dog one year, see a dog the next year and say, hey, since last year, this has happened, so let's talk. And we don't have that option with reptiles because the vets don't have that basic knowledge to do that.
I think I just come back to this issue. The curriculum is so crowded already.
Yeah.
I just think go and see an exotic vet. There are plenty of us.
Okay.
There will be an exotic vet within half an hour of pretty much everyone in the UK, I would argue.
I think I'm a bit selfish in that I like reptiles. I'd like my vet to know about reptiles, please. And maybe that's why I look at it the way I do. You
can't... If you're a jack of all trades, you're a master of none.
Point.
And I wouldn't... I'm not an expert in cats and dogs.
Yeah.
I learned a lot about cats and dogs at uni, but in the same way that I deal mostly with exotic animals, they deal mostly with cats and dogs.
Yeah.
I think the answer is pursue the exotic animal vets.
Yeah. Okay. Let's get back to the exercise question because this kind of falls into my half expertise as well as a former fitness professional,
of course,
and exercise enthusiast. What we know from human metabolisms is that exercise was missold as a slimming, as a solution to body fat. Yeah, exercise is wonderful for health, for all aspects of health. But my average workout, where I thrash myself to the point where my eyes bleed, would generally burn sort of 300 and odd calories. Now, some people exercise more than that. My wife's brother has just done a 50-mile run through the Peak District. He puts in hundreds of miles a week, and he probably does burn a significant amount of calories. But me, my 300-calorie workout, that's a slice of cake.
Yeah.
So losing fat with exercise isn't easy as humans. How relevant do you think exercise is for reptiles, and how much can be done in that respect? Now, we'll appreciate exercise for health. We'll appreciate exercise for body conditioning. I'm fully in agreement there. And I'm not saying that exercise is of no use for reptiles, because, of course, they don't use their calories for body fat,
exercise is difficult. You can't really put a bearded dragon on a treadmill, sadly.
Good point.
Two things. First thing is space. Generally, if you give them more space and they've got to chase their insects over a wider space, or they've got to travel between the humid hide and other hides and the basking area, and they're moving around more, that is exercise.
Chasing food is such a good way of bringing enrichment.
So
and
stop feeding leopard geckos only mealworms in a bowl.
Stop feeding your bearded dragon with tongs.
Yeah, exactly. And
maybe failed feeds as well for snakes.
Yeah, I mean, just going back to the mealworms thing, not only are mealworms sat in a dish and require no input or energy to be consumed, but larvae, so mealworms and waxworms and moria worms, are higher in fat.
Yeah.
Often they have, well, certainly in the case of mealworms, they have an inverse calcium-phosphorus ratio.
Yeah.
So
explain that to me just in terms of...
Basically, that means that if an animal is eating lots of mealworms, they won't get enough calcium.
Because the phosphorus, which counterbalances the calcium.
Exactly. You should have more calcium than phosphorus in simplistic terms, rather than the other way around.
Which is what the mealworms
exactly
have. But let's say then that we wish to stop feeding our bearded dragon or our leopard gecko from a dish.
Yes.
And so we're just going to release them into the enclosure for them to hide in the leaf litter, empty their gut contents, and therefore be mainly exoskeleton and therefore nutritionally unsound. How do you balance that then?
Well, it is a balancing act. I mean, and also there's an issue potentially with leaving some insects in because they can bite the animal.
Lizard,
So I think it's a case of put some insects in. Some of them you will lose, and you might even lose some under the fridge in the process as well. But you will see your lizard chasing them around, and you will see them. And at the end, if the lizard's finished and you can see some, take them out.
Harvest them back.
And it might be that one or two or three others materialize later that day.
Will live.
Take them out. They'll probably live. Just check your animal regularly.
Yeah, that's a good point. And again, leaving food in the enclosure to excrete its gut contents and therefore be nutritionally unsound, the only liquid thing it can eat is reptile feces.
Yeah.
And so then you're feeding a bug that's gut loaded with reptile feces.
You've just got to be sensible. I mean, in my experience,
once they've finished eating, take all the rest of them out.
When I kept lizards, you put the insects in and they eat them straight away. And of course, there might be some then that are left over, but try and catch them and take them out.
Yeah, that's good practice.
If your enclosure is very big, and you've got vegetation in there, and it's probably less of a risk anyway because there are other food sources.
Absolutely. I think we're coming to the end of our conversation. I'd just like to ask you about artificial diets for reptiles. How do you think that fits into the obesity query?
I'm not a huge fan of feeding lots of calorific treat-like items. For example, sugary jelly pots, which have become very fashionable. I think some of the complete diets for reptiles, though, as in the diets that you reconstitute, that almost form like a gel.
Yeah.
Nutritionally, actually, some of those potentially are quite good because they are formulated to have the right amount of vitamin A and calcium and fat and energy and protein in them.
Yeah.
It's not really a thing in many species, is it? I mean, it's crested geckos. Tortoises. Again, this might be controversial. I'm not a huge fan of tortoise pellets. Tortoises should be eating very little protein and mostly fiber. So maybe if you're feeding fiber pellets, but the concentrate carbohydrate pellets, personally, I'm not a big fan.
Okay.
Stick to your greens and your veg. But some of the other commercial formulas for reptiles, I think, are promising.
You'd need to pick and choose your artificial diet.
Exactly.
To be very careful about it.
Exactly.
Okay, to close up.
Yes.
I'm going to ask you, I've presented my obese reptile to you.
Yes.
Give me some advice that I can take home and implement quickly. And this would ideally be generic advice that any one of our viewers could
I would say,
implement.
how big an enclosure do you keep it in? And they might say a 2-foot enclosure. And I say, well, have you got the space for a 3-foot or a 4-foot or a 5-foot enclosure?
Okay.
Put enrichment in the enclosure.
Such as?
Multiple hides.
Multiple layers.
Multiple
levers.
layers. Climbing branches.
Yeah.
A substrate with a few inches so the animal can dig.
Yeah. Feeding regimes.
Feeding regimes, I think, feed it. It depends what you're doing, but the advice might be feed it less often, or feed a smaller prey item, or feed a less calorific prey item, or increase the amount of veg that you're feeding it.
That's a good one for herbivores and omnivores, isn't it?
Bearded dragons especially, because adult beardies should predominantly be eating veg with some insects, rather than predominantly insects and some veg.
My wife loves watching bearded dragons eat on Instagram. And this is why I think most people will feed more locusts or crickets, because it's entertaining to watch. But yeah, going back over to the herbivore side of the diet can solve some of the problems.
And if someone comes to see me and says, I'm thinking about getting a Bosk monitor, what's your advice? My advice might be, well, what about an Aki?
Yes.
Yeah.
I think that's a great place to finish. Thank you very much, Tariq. I'm going to ask you one more question.
Sure.
As a specialist exotic vet, as somebody who's passionate about reptiles, if you could pass one law that would help people to keep reptiles responsibly, what would it be? What advice would you give for people to become more responsible reptile keepers?
I don't know. That's a really difficult question. But I think what we need to do is vets and keepers and organisations need to come together and publish more guidelines, just like the FBH did with that enclosure-sized document, so that people have something that is peer-reviewed and evidence-based and agreed across the board and co-badged across the board that they can then follow. I think that would be a massive step forward.
I think that's a great answer.
I like this idea of pet know-how.
Yeah.
You know, this sort of, it's not an exam, but it's just a short test that you sit online and you print out a certificate so you can at least go in and say to the shop owner, I've done some research and I've got some proof, because research is so important. And I think as the reptile hobby, we should come up more with a traffic light system, an organisation of species which suit advanced and intermediate and beginner species.
That's interesting.
And we should use that to self-police ourselves rather than allowing governments to bring in positive lists.
When they perceive there to be, or are forced to perceive there to be a problem.
I think us policing ourselves is the way forwards.
I think you're right, Tariq. Thank you very much for your time, my friend. It's been fascinating again.
No problem.
And we'll be back to talk about other veterinary topics in the future, I'm sure.
Thank you for having me.
Thank you very much.
If you love reptiles and care about reptile welfare, why not become a responsible reptile keeping member? For the price of a cup of coffee, you can receive a whole range of membership benefits, such as our free quarterly magazine, responsible reptile keeping mugs, t-shirts and window stickers, as well as discounts from selected reptile retailers. To find out more, head on over to responsiblereptilekeeping.org.